Earlier, my colleague Jessica Easthope spoke with Dr. Robert Tiballi, an infectious disease expert at the Catholic Medical Association. She began by asking him about the president's recovery since he's in what is considered the high-risk group.
Technically, he is, by reason of his age, in the high-risk group. He's a little bit overweight, not grossly overweight, but so patients who carry a lot of extra weight, their increased risk carries through, and it's related to the 40, 50 pounds of extra weight that they may be carrying in fat. He doesn't have diabetes, doesn't have high blood pressure, doesn't have heart or lung disease, so chances are that he'll probably do quite well, despite the fact that due to his age, he's in one of the higher risk groups. He's going to have to quarantine for at least 10 days. Now, he's tested at least once a day and probably on the order of 4 to 5 times a day. And the fact that his close advisor, Hope Hicks, was not feeling well and had some nasal stuffiness and a little low-grade headache, she got tested and was positive. And then, therefore, he was tested because she's in close contact with him. Now, we would expect that he would do well, hopefully.
And the president is believed to have mild symptoms right now. We know this virus really affects people differently. What could that entail for him?
Well, mild symptoms would include some nasal stuffiness, a bit of a sore throat, mild headache, just a feeling of general malaise, maybe some muscle aches. Some people have a cough. Other people can develop a high fever or diarrhea. But the mild symptoms are normally very similar to what you might have with a spring or summer cold that you might get.
And what about the First Lady, someone who does not typically fit into that high-risk category? What does this diagnosis mean for her?
Well, I believe she's 50 years old, although she looks younger. And so most of my patients that are in similar fashion with her that have gotten ill with COVID do very well with only symptomatic relief, including pain relievers like Tylenol. So they normally do very well.
And we're about a month away from the election. The president is obviously running a campaign, has to be very active. If he doesn't make as swift of a recovery as he hopes, how could his campaign be affected? Would we have to do everything virtually instead of being out in person with voters?
Well, clearly, if he wants to maintain his schedule right now and he's physically able to do so, the early word is that he's really doesn't have significant symptoms. He could continue virtually. We would advise him not to exercise because the heart can get affected in this situation. The doctor that is caring for him, the White House physician, had previously prescribed hydroxychloroquine for him. We don't know if that's going to happen. A lot of the world literature appears to be that that's helpful if started within the first 3 days of infection, which certainly the president is within. So it all depends. A lot of people, after they recover, even if they've got a relatively asymptomatic infection, can have significant fatigue. And so the demands of a campaign like this are very taxing and tiring and fatigue-producing. But he should be able to resume his normal schedule if he does well in about 10 days.
And speaking of those preventative measures, President Trump has had mixed feelings about wearing masks. His campaign has held large rallies during the pandemic. If you were his doctor, would you feel that he put himself at a greater risk?
Well, by virtue of his position, he puts himself at great risk because he has to receive so many people. And as we all know, you can't get within 6 feet of the president unless you're a very special person. He has signed things and shaken people's hands and so on. And he did not use masks early on, but this is an infection he's acquired within the past 7 days. And clearly he's been wearing masks quite frequently recently. He's had a bit of a conversion on the use of masks. Hopefully his vitamin D levels are adequate because that's very important to do well with coronavirus. And he appears to be in excellent health otherwise.
And Dr. Tiballi, lastly, what advice would you give the president in the coming weeks and months?
Well, I would tell him to take it easy. He seems to be someone who doesn't sleep that much, and he's going to have a need for sleep in his recovery. Virtually everyone, even if they're asymptomatic, has significant fatigue, and taking naps is not a bad thing even for someone with a schedule as demanding as he has. That's really about it. His doctors will evaluate him, make sure he gets his influenza vaccination, make sure that he doesn't have any post-viral bacterial infection with sinusitis or bronchitis that can follow something like this. And they will check to make sure he's not at risk for clots. Patients, even with asymptomatic infection, can sometimes trigger a cascade, which could make them at increased risk to develop a blood clot in their, in their leg or vein. And I'm sure they'll follow him closely for that.
That was Dr. Robert Tiballi of the Catholic Medical Association. And on Friday evening, the White House said that the president has been treated.
If you're watching Currents News on YouTube, be sure to hit the subscribe button and then click on the bell to get instant updates about all of our newest content, because we are putting your faith in the news.